Hi, good evening to the Monster listeners tonight. So I'm a pediatrician. I look at kids and babies, and I practice in Makati Medical Center and also in PGH, or Philippine General Hospital.
Nice. Welcome, doctors. Thank you so much for taking the time to join us here. Actually, a little bit earlier. Normally, we go on air at 11 p.m., but because of the ECQ, we've been able to go on live a little bit earlier. And I'm sure you're all very busy. So I just wanted to ask you, outside of your work, usually this is my first question to all my guests. Outside of being a doctor, what have you undertaken during this pandemic to keep you more sane? Have you watched a new Netflix show? Did you become a plantita? What is the story? Doc Angge, you seem to have an answer ready already. I see you smiling.
Yeah. So, well, last year when we had the first ECQ, so I like to bake. So when I was busy with the practice, so I didn't really have a lot of time. So during the first ECQ, yun, I tried everything. I did the cheese pandesal, the cinnamon rolls, and everything that was everything that people were doing. So yun, so that was what I was doing last year. But now busy again, so not much baking.
Okay. Well, I mean, I guess busy is better, right? In a way, especially. Well, I don't know if is that a good thing for doctors when you say we're busy, because usually that means there's more people who need medical assistance. Is that something that you look forward to when you're busy as a doctor? Just wanted to get some insights from the three of you on that.
Actually, so I'll answer. So
Of course.
actually, because so I'm not only a doctor, so I'm also, like I said, I'm connected with PGH. So I also teach. Also, Makati Med also has pediatric residents. So besides being a doctor, we also
Mhm.
have different roles, and I think Wyeena can also share because she's also very busy.
Perfect. Doc Wina, why don't you share your story now?
Well, if I'm going to follow what Angge was saying earlier, last year, after the first lockdown, I ventured into the world of Korean novellas. I wanted to know what was about. I didn't get into the plantita mode. No, I don't have a green thumb, unfortunately, and I didn't bake, so I just watched.
Okay.
But last year, we still had, I teach or I'm a clinical guest faculty with the Ateneo School of Medicine. So we were really busy thinking of ways on how to continue teaching via online
Mhm.
mode. So it was still busy. We had to stop for a while with the clinics. I only tended to urgent and emergency cases and also with pregnant women who were about to give birth. But other than that, I did all my consultations online.
Okay, great. And Doc Man, how about you? Anything that's been outside of the medical field that's been keeping you busy?
Well, just like Dr. Angge, last year, I started teaching myself how to cook. Pero this time, it's really ulama, like meals. I bought
Okay,
myself an instant pot. And thanks to YouTube, I taught myself how to cook.
nice.
And yeah, I'd just like to comment on what Dr. Wyeena said. Actually, next month, we will also be training residents about online consultation. So it's
Mhm.
very timely yung our show tonight because actually everybody is on on this platform for consultation. Online is the in thing right now.
Yeah, it's the way to go. And just out of curiosity, for all our listeners out there, the three of you all seem to know each other. How did you all meet? I mean, I don't know. I'm not a doctor, but it seems like all the doctors seem to know every doctor, no matter what field. Is that how the case is, or did you meet somewhere before this, so that you all? What's the story behind the three of you being friends?
Well, Maan was my first friend in college with the block because I think we were blockmates during our first year
Yeah,
in college. And
you were in
Angge is the
Sumilang. Yeah.
older sister naman. Angge is the older sister of one of our barkada.
Oh, okay. In a way, even though you, let's say, for example, Doc Wyeena and Doc Maan, you were blockmates before, but you ventured, and eventually all three of you ventured into different specialties, different fields. But I'm sure the question that you have been receiving, no matter what field you're in, has been related to COVID. Would you say that you still get a lot of questions about the virus, even though it might not necessarily be in your specialties? That's something that you've experienced, Doc Angge. I see you nodding your head. Do you get a lot of questions about COVID?
Yes, especially last year, right? When
Mhm.
we didn't know much about what COVID was. How did it really spread, no? So a lot of friends and family syempre would text me or would call me and ask about it. And I guess until now, no, because now we have the new variant, the Delta
Mhm.
variant. So there's another, it's a new cause for concern. So of course people close to us would usually ask us about it, and even
I see.
our patients,
Mhm. Yeah,
Yeah,
Doc
that's
Man.
important.
Yeah, regarding, because you're a dermatologist. So when people think dermatologist, they usually think skin. But I'm sure you've also received questions about COVID. How do
Yes,
you normally address it?
yes. Usually, patients come to us asking if it's okay to get vaccinated, especially those who have history of allergies or have existing psoriasis or atopic dermatitis. Usually, they get clearance from dermatologists.
Oh
So
wow.
they
Okay.
ask us, is it safe to get this kind of vaccine? What are the side effects? What should
Mhm.
we do if we have those side effects?
Okay. And actually, since we have Doc Man here, who's of course the CEO and founder of My Skin Specialist, why don't you talk about My Skin Specialist? What exactly is My Skin Specialist?
Well, actually, it's an interactive website. It was specifically made for dermatology patients. So it was started last year for online consultations. And I think now a lot of other specialists have followed suit. They
Mhm.
also have their own online consultations. So
I
it
see.
is the trend because of this pandemic. And a lot of patients have already benefited from online consultation.
Okay. Doc Wyeena, is there something similar in the OBGYN universe, in like an app? Are there apps specifically for OBGYN use and for the women that need to avail of those services?
No apps actually, but what I do know is that one of the companies, especially the yung contraceptive company, I
Mm.
think for last year, they did release a platform where women, especially those who were concerned about birth control, especially
Mhm.
during the quarantine, na they can ask, para siyang bot, something. I
Mm,
don't
like a
know
chatbot.
the lingo.
Yeah,
There's a
chatbot.
chat bot, yes, that they can ask so regarding all the different types of contraceptives.
I see.
But otherwise, no particular platform aside from the usual, the Zoom, yung iba-ibang klaseng platforms when it
Mhm.
comes to type consultations.
I see. Well, although the online consultations is the main focus of tonight's discussion, I wanted to ask each of you individually: have you made a return to your clinics, or what is the status of your physical presence at a physical location outside of your home at the moment? Doc Man, for your clinic, your dermatology clinic rather, have you been has it been open throughout the last year? What has been the kind of the ebb and flow, especially with all the MECQ, GCQ, ECQs that have been thrown at us constantly?
Well, personally, I started seeing patients in person since August of 2020.
Okay.
So basically, I just stopped for like 3 months and then I started going back. But I limited my clinic hours already and shifted to online consultations half of the week.
Mm-hmm.
In our clinic, before the ECQ, we had a lot of patients recently, but yeah, most of them are also shifting to online.
Online. Okay. And
Mm-hmm.
actually, since you mentioned it already, Doc Maan, when it comes to dermatologists, I mean, even me, who's not, I actually, truth be told, I have not been to a dermatologist ever. But
Oh.
I know it's about, taking, it's about your skin care, or it's about your skin, not necessarily skincare like what you put on your face, but just your skin in general and how to take care of it, how to keep it healthy. Would you say that it's something that is very difficult to conduct online? Because I'm not a dermatologist, but I assume you'd have to touch it and be more in a, everything that's basically anti social distancing. You'd have to do to be a dermatologist, right?
Actually, I'm not sure about Dr. Wyeena and Dr. Angge, but in the
Mm.
clinic, we try to minimize touching the patient. So we have
Okay.
to follow social distancing as well.
Wow.
We have an acrylic barrier when it comes to consulting with patients. So when it comes to online consultation, personally, I require my patients to submit photos of their lesions, clear
I see.
photos, because our
Wow.
field is very visual. Yes, so we need to see the lesions first because not everybody has clear camera. So
Mm.
during the consultation, we already have an idea of what the patient has.
I see. Okay. Doc Angge, how about you in your field, pediatrics, especially dealing with kids? That's something that must be very sensitive, especially for the parents who are concerned about their children. How has that worked out for in person visits or clinic?
Yeah. So, like Maan, so actually the two hospitals, the two clinics that I go to, we really closed no, during the ECQ, and then Makati Med started to allow us to have in-person clinics around May, but before we did that, they checked first our clinics, no, so they checked the events, they make sure that the clinic is safe. And then also we had several parang mga seminars no on how to make sure that the clinic space is safe no for
Mm.
our patients. Kasi yun naman yung una talagang tatanungin ng patients no, doc safe ba pumunta sa ospital, 'di ba? Kasi they really associate the hospital na may mga patients na may COVID, 'di ba? So there's really fear for them. So we really try to make sure na we address those fears by making sure that the clinic is safe. So, yun nga. So kami, kasi we give ano 'di ba, vaccination. So hindi siya pwedeng online. So, yun. Pero before that, before they go to the so I guess one of the things that we really parang did new last year was by appointment. So we didn't accept any walk-ins, no. So before the patient goes to the clinic, we make sure to screen them, no. So we have the health declaration. We make sure na there are no symptoms of COVID for the kid and for the parents as well or the caregivers that's accompanying the kids. Initially pa nga Makati Mad was really strict no dapat one ano lang one
Companion.
One companion.
companion.
Mhm.
Pero syempre especially for the babies or the toddlers, 'di ba mahirap yung one companion lang, yeah. So they allowed na rin both parents no or the yaya to join the mom. So yon. So since May last year, I've been doing face to face. And unfortunately yon, we really cannot do parang social distancing when we're giving the vaccines. Talagang
Yeah.
it's really close contact. So we just really make sure that we wear our masks properly, we have our face shields, and then the parents and the pero except for those who younger than 2 years old no, so hindi pwedeng naka-mask kasi. But
Okay.
those are the things that we did in the clinic.
Well, I'm sure a lot of parents out there who are listening. I'm sure their minds are put at ease, especially with the precautions that you've taken. You said there are seminars that really educate everyone in the facility to give the best care. Doc Wyeena, on your end, naman, I butchered it when I introduced the term. I say OB. How do you say it? How do you say it? I'm sorry. I'm so bad at it. But also, I want to talk about your specialty, urogynecology. What exactly is that, and how has it? Can you do that via a remote consultation, online consultation?
Well, it's very challenging for our specialty. Of course,
Mm.
I deal with my practice. I mostly deal with either pregnant women, a very vulnerable group, or the menopausal women. Again, the one of the mga senior citizens, so vulnerable group. So urogynecology particularly deals with um, certain conditions. It's so very hard to explain. Certain conditions which typically happen with the elderly. Yun yung mga pelvic organ prolapse, urinary incontinence,
Mhm.
overactive bladder, those type of things. What's good about it's not parang mga emergency cases. So it's not urgent. So we can actually do teleconsultation. What's very difficult though is that, of course, we need to do our physical examination to complete the diagnosis. So that's the challenging part. With respect naman sa mga pregnant women, we had to alter how we do our prenatal checkups. Kasi before, we do it every month. But now, we do it ng parang longer interval so that the pregnant women won't get exposed too much when they go to the clinic. In the medical city, it's a hybrid hospital. So literally, the COVID wards or the COVID area is literally separated from the non-COVID. Like literally parang different air, everything. So in the clinics naman, we have our prescribed PPEs. And it's very difficult, especially when we deal with pregnant women, when you have to check whether or not they're in labor, if they have problems, you have to check the baby, their heartbeat, so you have to touch the patients. But again, I do everything, like Angge said, by appointment. So literally, we have time slots. I don't want my patients, I go on time. It's always on time. I'm never late. So that talagang you see them during the time that they're alive, and then they don't, hindi sila nagkumpul-kumpul outside your clinic. I'm very strict about that because I also disinfect the clinic after, because yung table, the desk, everything that the patients touch, I disinfect for 5 to 10 minutes after. So it's really a long consultation. It's very hard talking with masks on also.
Okay. All right. Well, there you go. I mean, as you can see, monsters, all three doctors kind of gave different answers, but it all comes down to they take all the right precautions. So if it is anything that has to be done in person, you can see that they have been trained. Them and their staff have been trained to. So it's probably the safest place. If you're going to go to hospital, it's probably one of the safer places versus going to, let's say, I don't know, a restaurant that maybe doesn't have. I'm sure I'd like to have faith in restaurants and that they also sanitize everything. But at least we know with the doctors, as you can see, it's evident from the answer, from all three answers, that they take all precautions. And if they can do things remotely, like Doc Maan takes photo or asks the patients for photos, and of course Doc Angge was talking about the getting all the information. If they have to be there in person, they have to get all the information. So thank you for answering that and putting our minds at ease. And I have a question. I don't know if it's a taboo question to ask doctors. I don't know if you don't want to answer it, it's very okay. But there has been a lot for people like me who are not medically trained. There is a lot of outcry over the face shield. So Doc Wyeena was talking about PPE when you wear it. So Doc Wyeena, just when it comes to your practice, is part of your PPE is also the face shield, correct?
Yes.
But there's a lot of, I see a lot of varying information. I don't know what to believe, who to believe. I see doctors saying it's good. I see doctors saying we could go without it. If you're comfortable answering, what are your thoughts on the face shield?
Well, for me, because some of my patients do ask me that, and I tell them that if you're going to a place where there's it's not an open space, like you're enclosed in an enclosed room, and kunyari, for example, banks, you cannot do the social distancing to a maximum talaga. Diba? Pag nasa banks, there at some points you will be close to another person, especially in the grocery. So during those times, for me, I think it's more prudent to wear the face shield because some other patients or some other people don't also wear their face mask properly.
Yes.
So, but if you're like out in the open, in the park, and nobody's within throwing distance, I guess. Especially if you're doing some activities pre-pandemic. I mean, before our ECQ, diba, you can walk in the park, you can jog, you can run. I think for safety reasons, you're not supposed to wear face shields then.
Yes.
Yes.
Understood. Doc Maan, Doc Angge, if you don't want to answer, it's fine. You can abstain. I can move on to the next question.
Yeah, actually, I agree with Dr. Wyeena. No, I also advise my patients to wear the face shield as an added protection, especially where they're indoors. because we cannot rely on other people to wear their masks properly, especially if we are very careful ourselves. We don't know if the people around us are careful as well. So there's no harm. It's just,
It's just added,
it's
right? There we
safer.
go.
Yeah, it's very
All right.
light and it's not really hard to do.
Perfect.
Not really hard to do versus being intubated and being
Yeah.
in the
Yes.
with COVID.
Well, that's the answer I wanted to hear. I'm sure there are a lot of people out there that maybe I could guess maybe they're tired of the pandemic and maybe it's just a little freedom that they crave. But you heard right here. It just added protection, and I agree. I agree. So let's talk about speaking of protection. Most people are gravitating towards the teleconsultation or online consultation, as we've been talking about throughout the show. So let's start with Doc Maan because you specifically gave as an example of you asked patients to send photos. But how is the whole process? How is the whole process for a teleconsult when it comes to dermatology? So to all the monsters who are maybe looking to get into or maybe need a consultation for a derma, how does it work in your field, Doc Maan?
Okay, it's very similar to booking an appointment with your doctor for in-person consultations. So this time, you're like making an appointment via internet or online. So of course, you have to pay online. You have to choose the day that's convenient for you and the time. And for us, for dermatologists, it's very, very helpful if you can send us photos of your lesions and like maybe give us a brief description of your problem. For example, if you've been having allergies for a week, maybe you can put that. Or if you have allergies to certain medications, so that when it's the time for us to consult with you, with us, we can already have an idea of what your problem is.
Uh,
Um,
Doc Man, just to make some to just to clarify on some points, when you're talking about all this exchange of information and photos, is there a platform that you in particular prefer, or is there a platform? Is it through the app that you were talking about, or is it through Facebook Messenger or Viber
what
or WhatsApp or Telegram?
we have
What exactly is the
Okay, it's
platform?
different for every doctor. Actually, there are a lot already, but for my skin specialists, we have our own website and we
Mhm.
use Zoom for the
Zoom.
consultation. I think others use what do they use? Facebook Messenger, I think, or
Messenger.
Viber.
Wow.
Yes, I'm not sure if they use StreamYard, but they use several kinds of platform.
Wow. Okay, it's interesting. I mean, I did not expect. I mean, Zoom. For me, when I think Zoom, I think corporate. I think, but Facebook Messenger. When I think Facebook Messenger, I think of my my Lola. If I'm gonna message my Lola, right Messenger. But I guess that in a way, by doing it through platforms that are familiar with people, Messenger, Viber, and whatnot, it makes it a lot easier.
WhatsApp, yeah. Some people
Yeah.
use WhatsApp.
Yeah.
Great. And I'm sorry, sorry to cut you off earlier. So you to continue with the rest of the process after they send you the photos, after they consult, after they give you all these disclaimers like I blah 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 for the last week. What is the final kind of end game to that? What's the conclusion to this process, the teleconsult at least?
So when we see the patient, everything is online. So even your prescription, if we have to request for laboratory exams, you get it in your email right away. So
Wow.
even your follow-up consultation is there. If medical doctors advice, everything you get immediately after the consultation. So it's
Wow.
in your email. Very high
Nice.
tech, huh?
Just to touch again on what you just said, the the receta, the
Yeah,
prescription,
it's
it can be
e-prescription.
done
We call it
online.
e-prescription. Yes.
Wow. How is the just to because I've seen in movies and whatnot TV shows where people when they have to get a prescription for something they especially this is an extreme case but for people that want to abuse the prescription system they get the prescription and they go to their doctor friend for example blah blah blah. Is there some sort of risk for abuse of an e-prescription? How does that work? I mean, because you have to sign it physically normally. So do you just
Mhm.
e-sign it? Can they alter it, for example?
No, for every patient that we see, they have to make an account. So there's one account for every patient. All the information about the patient is inside the account. So when we write a prescription for you, your name
Mhm.
will appear, your age, where you live, and everything else. So it's just
Oh,
like,
okay. Just like
an ordinary prescription.
hmm, nice. And everything you just type it out as you as on the doctor's side. You just type out all
Yes,
the information. Wow.
so it's
Uh,
paperless already.
Nice. And not to play on the stereotype about doctors' handwriting and whatnot, but did that put your mind at ease for like, all three of you? My handwriting is awful. They always say my
Mine is
handwriting looks
good.
like doctor handwriting.
Me too.
I have
But
no
at least
Yeah,
problem
we're
with
all
my handwriting.
we're all from girls' school, so I think we have
Yeah,
nice
we have.
handwriting.
good. That's great. That's great. You are breaking the stereotype. I don't know. I don't even know why that stereotype exists because every doctor that I've had give me handwritten things. I could read it, so I don't really know why it exists. But I just thought I would ask on that end, just
No,
in
but
case.
I see other doctors' handwriting, and they're terrible.
Terrible.
Even I
Okay.
can't read it.
Doc Angge, let's
Yeah.
talk about your. I know you said that especially for vaccinations,
Mhm.
you cannot do online consult. But what in your world, in your expertise, what is the process if there is anything done online? What is usually the process?
Okay. So actually, I'm not also a very techie person. So last year when the
Mhm.
ECQ started, so parang yun nga, no, parang how do I contact my patients or how do they contact me? But ano naman, usually like my old patients, especially kunyari if they've been with me since the baby was born, so they have my number. So anytime naman that they need emergency consult, they can contact me. But for those that don't have my number, so Makati Med gave us a platform, no? And then, but I'm using now Sirius MD as
Mm.
my platform to do my teleconsults. And it's very similar to Maan. So you give them the link, and then they click on it, and then they set an appointment, and then I accept the appointment and I set the time. So and then yon. And then after that, yon, pag on the day of the consult, so we do the teleconsult. So usually also there in the Serious MD, they already put the reason for consult, no? So kunyari if it's fever or if it's cough or they just want well checkup, so I already see beforehand what the problem is.
I
And
see.
then yun. So usually that's how I contact the patients. But yun nga, so sometimes naman if they're not techie or medyo nahihirapan, so I
Mhm.
also can contact them through Viber. Yun nga, no? So Viber. And I know some of my friends also use the Facebook Messenger to do their teleconsult. So yun nga, like what Maan said, there are a lot of platforms already available for teleconsultation. So, but for me, I use Serious MD.
Nice. And of course, Doc Wyeena, you mentioned earlier that your specialty especially focuses on a specific niche of patients, and you mentioned the elderly is one of them. And of course, when it comes to well, I'm just going to use my mom as an example. My mom learned how to use Viber. I mean, she learned how to use Viber, but only maybe in the last 2 years did she learn how to put mga gifs and mga stickers and whatnot. But do you have issues on that end when it comes to to getting your patients to do the thing online, to do their thing online?
Well, my patients have children who know how to do, and the children arrange for that.
I see.
So for me, I also used Serious MD before. I have to talk to you and get later because I don't know how to. Because that's where I get referrals. Eh. I mean, I got surprised. I got a lot of inquiries from there. But for my older patients, or for my old patients, the patients who have been with me for years, they just contact my secretary, and my secretary arranges for the appointment or the scheduling.
Mhm.
I usually use Zoom.
Zoom.
So I usually use Zoom. So it's very easy for them kasi they just click the link and then it's there already as long as they Zoom and MS Teams.
Ah,
Um, and usually it's especially for pregnant women and the elderly, they prefer to do teleconsults first. And
okay.
then after I give them the laboratories or I give them their initial medications, during the follow-up, that's when we'll do our physical exam. And I think in a way it's advantageous because it lessens the time that they're in the hospitals. Because sometimes they're afraid. Although most of the time after they've been to the hospital, like you said earlier, they have the remark na feeling nila it's safer in the hospital because everybody's so strict, everybody's wearing their PPEs
Mm.
properly.
Okay.
So, my elderly patients actually are parang mas matapang when it comes to following up ng face-to-face as opposed
Mhm.
to some others who prefer to do teleconsultations first.
Right. Okay. Good to know. Good to know. And to all our monsters out there, we have a question actually off of Facebook. But this is also an open invitation to all our monsters listening right now. If you want to call in 863-19393, or you can comment on the Facebook, YouTube, or Twitch live stream. But question for our doctors this evening from Angel off of Facebook asking, can you ask the doctors what is their biggest struggle doing online consultation? So I know you mentioned a few already, especially when it comes to maybe not being able to prevent social distancing and whatnot. But just a question for the three of you: what is your biggest struggle doing online consultations? Doc Angge, for you, what in your opinion, what is your biggest struggle?
Oh no, the Wi-Fi connection. No, it's really, ano, kasi yun, so parang kunyari in the middle of the console, biglang, hello, hello, can you hear me? And then, or alam mo, parang ang dami mo nang nasasabi, tapos biglang hindi ka na pala narinig. So, yun, I think talaga, that's really one of the biggest struggle. For both sides, no? Kasi sometimes, sa side din ng patient, hindi din maganda yung Wi-Fi connection nila. And then yun, yung katulad ng kimaan, kunyari, because also kids present with rashes, right? So sometimes the parents will take a picture or video, tapos talagang parang hindi ko makita. Alam mo yun, yung gano'n, na parang it's not clear. So you
Yeah.
have to ask them several times to take a better photo of the rash, no? So that I can diagnose it better, no? So yun. So those are, I think, some of the struggles when we do online consultation.
Okay. And actually, since you talked about like photo quality or just quality in general, internet, whatever, maybe a good question for the three of you: did you have to upgrade your home setup? For example, here at the Monster, we bought lights. We increased the bandwidth of our internet. And for me at home, I had to buy a new microphone. But for the three of you, did you upgrade? Did you make some upgrades at home as well?
For me, I got lights, yeah, just like you, and I had to buy this mic.
Ah,
Ta-da! I don't know if you can see it.
yeah,
And a camera, a very clear camera. It's
mhm.
very important for us to see the patients and for the patients to see us as well.
Yeah. And Doc Man, how about in response to Angel's question, do you have any other any struggles, or did you already mention them earlier?
I think mine is the same as Dr.
Yeah.
Angge's. It's the Wi-Fi connection talaga. But
Okay.
we make adjustments. You can always reschedule if there's really a problem.
And Doc Wyeena, any more to add to that? I assume Wi-Fi is also on your list of problems, but anything else on top of that?
Well, usually it's just because it's hard to give a diagnosis without physically examining the patient. So
Mm,
usually that's the thing.
okay. Got it. Got it. And Angel also has a second question. I'm sure she's not being facetious. I think this is actually, there's some half meant to this, but how do you feel when most people think online consultations, you think it's free? Because
Oh, can
truth
you
be told,
answer that?
yeah. If you'd like, what is the, because for me, for example, when I go online, when I see something is free shipping, free whatever, that's the first one that I choose. Are there medical professionals that do a free online consultation for the first time? Is that something that's common in the business? Or if there's a free medical consultation, should we exit that site immediately? What is the your take on online consultation maybe being free or cheaper than normal?
Cheaper.
Is that
Well, last year I did offer free consultation, and
okay?
not just for OB/GYN and Urogyne. I handled psychiatric patients. I talked with because very high anxiety last year.
Yes.
I had
Mm,
several
right.
consultations very late in the evening. They'll post a question or they'll consult because they feel that they're having a heart attack. I had several patients, parents who consulted about their children. And finally, Just last week, most of those patients who I heard from last year, early on last year, because I guess nag-ECQ again,
Yeah.
they had consultations again. And I knew those patients naman. So I didn't charge. So kasi it wasn't like online na naka-Zoom.
Mhm.
They were just messaging sa Facebook Messenger because that's where I offered yung free
Right.
consultation last year.
I
But
see.
other than that, no naman. I've never had an experience where a patient, a new patient at that,
Mhm.
expected that it's going to be, they actually ask first
Okay.
about how they are going to settle
Got it.
their
Okay.
fee.
All right. So, word of advice to the monsters out there: make sure you know what you're getting into. Ask, of course, how you're going to settle, and of course, if they offer, like Doc Wyeena did last year, free consultation, then it's a win-win. You know, it's a
But
I
win-win.
think,
yeah,
ano,
for JC, we have
Yeah,
actually free online consultation for dermatology.
dermatology. Okay.
Because pre-pandemic, we have government institutions or charity hospitals that perform free consultations for these types of patients. So
Mhm.
now that we have transitioned, we will be also opening up to these types of patients. So, for
Okay.
example, if for Hospital ng Makati or Quirino Memorial Hospital for the indigent patients, we also have a link that they can go to and just tell the residents that, I was a former patient in Hospital ng Makati and I would like to follow up, so and
Mhm.
so. So yes, we have free consultation.
Okay.
And these are
Great.
being handled by our residents.
Great. Great. And for the people like me who are, admittedly, I know it's weird to admit this to three doctors, but I don't like going to see the doctor because I get nervous and whatnot. So, what tends to happen for people like me, they there's a wealth of information online. There are, literally thousands upon thousands of websites that where you can, in a way, self-diagnose yourself. I wouldn't recommend doing that. Of course, I'm sure none of you would. You, of course, go see a medical professional, but it tends to be the case when it comes to people who are maybe not experiencing a life or death situation, but they tend to find their information online and just bypass the medical professional altogether. They find resources online. What are your thoughts on online resources? Are there good ones? Are there occasions where you don't have to see a medical professional, where you can actually just go online and Google the answer to your health problem? Or is that something you should never do?
Exactly. Can I answer? So that's
Of course.
actually very scary, especially for us, because a lot of people just go online. For example,
Mm-hmm.
if you have a rash and then you Google it, and then you think that you're already Doctor Google yourself, and you self-medicate.
Oh
Usually,
no.
these types of patients come to us, and the skin lesions become worse than the initial presentation. So for me, I think if if you can afford it, better go to a board certified dermatologist. If you really can't afford the consultation, you can go to our, charity hospitals,
Mhm.
which also have a link. And you can be sure that you're gonna be handled by professionals.
Professional. I see Doc Angge nodding her head.
yes.
Doc Wyeena too. I assume you share the same train of thought. But do you have anything else you want to add, Doc Angge?
Yeah, so I was going to, ano, no, parang siguro follow up yung kay Maan. So I see a lot of parents, so they ask other parents what they give their kids for cough or for
Mm-hmm.
colds, diba? So parang they share information and yun din. So like Maan, parang that's a little bit, ano, no, scary nga, or parang it's not really it's not the right thing to do because it might be different, diba? And then what if you give this medication and it's not the right medication for your child? Especially sometimes they share antibiotics, no? So parang, oh, ito yung binigay na antibiotic ng doctor ko, try mo sa anak mo. So, I would, ano talaga, no, be more cautious. And yun nga, parang just go to your doctor. And like Maan said, kunyari here in PGH, we have our outpatient department, which the residents also, ano, no, parang man, and it's free. So, in case na parang they have questions, then they can, ano, there are a lot naman, no, a lot of the training hospitals have charity outpatient clinics, and they can go there if they do, if they cannot, ano, no, parang cannot afford the paid online teleconsultations.
There we go. I mean, so you heard it. If you can afford it, best to go to a professional or find alternatives where you can actually find a professional to help you because no one patient is the same. You could make things worse, as Doc Angge and Doc Maan mentioned right there. So in that light, since we're coming towards the end of the interview, and I know there's so many questions that still need to be answered, so many questions that could still be asked. But since our monsters were able to hear what you do, especially during this very difficult pandemic situation, I just wanted to go through each one of you and ask you what are maybe the most common conditions or illnesses in the field that that you're an expert in, and how how they can reach you, or let's say they're experiencing X, Y, and Z. What are the X, Y, and Z that you would recommend saying, hey, come see us, come go through our online consultation. Doc Wyeena, who has a very specific practice, what would you say to patients listening who might have a very particular medical condition that you would suggest for them to go consult with you?
Well, a lot of women right now experience actually abnormal bleeding, and that's because of the stress of this pandemic.
Mm.
And they usually know where to go. I mean, most women, they know that it's an OB-GYN that they need to look for. In terms of my subspecialty, which is urogynecology, usually patients who have difficulty controlling their urination, patients who feel that something's coming out of their woman parts,
Mm.
that's what you call the pelvic organ prolapse. Well, it's not really an urgent matter, so they can actually wait after the ECQ if they need to go to a urogynecologist. Um, but most of the time, only if you have problems urinating, you start to feel fever when you can't urinate, everything like that. Well, that's the time that you should seek consultation.
Great. And actually, now that we're already here, I mean, Doc, we know where can they reach you online? I don't know what the best way. Let's say somebody heard you right now and they said, "Oh, I need to consult with Doc Wyeena. She seems to, she seems like the doctor that I want to consult with." How can they reach out to you? Do you prefer a certain way? Is it through social media? Is it through a website? Where can they reach you, Doc Wyeena?
Well, they can reach me at the Medical City, Dr. Rowena Sumilang.
Okay.
The Medical City information, even the Medical City website has our number.
Okay.
And then they can reach that number.
Okay, well, there we go. Doc Rowena Sumilang from the Medical City. You can find her information on the website. Let's go with Doc Maan. Doc Maan, how about you? What are the cases that you would recommend to people to reach out to you, patients, future patients who need to maybe consult with a dermatologist? What would you look out for? And of course, the information of how to reach out to you as well.
Okay, so basically, dermatologists can help you with problems that concern your skin, your hair, and your nails. So if you have recurrent problems concerning these three organs, your skin, your hair, and your nails, you can just consult with your dermatologist. We actually have a website for all the PDS board certified dermatologists. It's www.pds.org.ph. Did you get that? It's www.pds.org.ph. And you can confirm if your dermatologist is indeed board certified. Okay. In my case, you can get in touch with me via www.myskinspecialists.com.
Perfect. And actually, that's a very important point that you raised, Doc Man. There are a lot of, skin
Yeah.
experts on YouTube and whatnot. So to have a board certified one is the way to go. So make sure, like Doc Man said, make sure that your healthcare provider is providing you with someone who's certified. And of course, Doc Angge, what sort of patients who are listening right now should reach out to you and also where can they reach out to you? Which hospital, which website, which social media account, if ever?
Okay, so for pediatric patients, so it's not only the acute problems, no, but of course, if the patient or their child has fever, cough, colds, and any diarrhea, no vomiting, so and they're concerned that the child is maybe not getting better or is getting worse, then they need to really consult. No? And besides the acute problems, so we also address child visits. No? So like updating their vaccinations. So yung nga, a lot of parents really, I think, got scared of bringing their children to the clinic. So actually nagkaroon nga yung mga drive-through and home visits, no. But I think for me, no, parang I'd still maybe parang recommend going to the clinic kasi nga like I said earlier, no, we really make sure that our clinic spaces are safe for our patients. So they can be sure naman na we really follow all the protocols, no. So yeah. And with regards to getting in touch with me, so yeah, they can get in touch with me through Makati Med website or yung nga through the Sirius MD. So it's siriusmd.com slash doc slash A Tomas. So if they need a teleconsult, so they can set their appointment through there.
Perfect. And thank you so much to our three doctors tonight for putting our minds at ease, letting us know that you can do it online, even through Facebook Messenger. If you don't know anything about tech, they will find a way. Also, thank you for putting our minds at ease for those who do have to come in person, that you are really showing us the that you take all the precautions and whatnot. On that note, is there anyone you want to say hello to? I don't know if your patients are tuned in, but I'm sure you have friends and family that you want to greet. If ever, Doc Angge, why don't you start if you want to say hello to anyone out there?
Well, I'd like to greet my my family and my friends who I told them about this this broadcast. So I hope that they're listening. So hello.
Hello. And Doc Maan, of course.
Yes, hello everyone. Aking three boys and to our friends, our UP friends. And also thanks to Rafi for inviting us. And also to you, JC. Thank you so much.
Thank you so much. And Doc Wyeena, of course, to round things out, anyone you want to say hello to, any shout outs out there?
Yes, I'd like to say hi to my family and friends who are listening right now, and most especially to one particular urogynecologist in Laguna, Dr. Rani Cadiz, because she said earlier pa shout out daw. Mga Monster listeners.
Well, thank you very much, Doc Wyeena, Doc Angge, Doc Maan. Thank you so much for taking the time out of your busy schedules to educate us this evening. And we look forward to having you once the pandemic is over, having you once again here live. Hopefully we can, no more acrylic, no more masks are needed. But until then, we'll have to do everything online. And thank you so much for doing what you do.
Get
Thank you for being
Yeah. Yes.
Get your
Stay safe.
vaccinated.
Be safe. Follow the health protocols, please.
Indeed.
Yes, vaccinated, please.
Thank
And
you for being
register.
the frontliners here, Filipinos. And to all the monsters out there, catch us once again next Thursday for more hot conversations with interesting guests here on Heard on Thursdays. My name is JC Tavis. Have a wonderful evening and always keep it locked right here on The Monster. Good night, everyone.
The views expressed in this program do not necessarily reflect those of the station or its management. Heard on Thursday.